Namaste viewers and friends. I'm here once again with the new series of our Ayurvedic herbs. In this series, we are going to talk about and know about different Ayurvedic herbs and how it helps to cure different diseases. So in this series, we'll be focusing on herbs in relation to how it can cure different diseases, because a lot of my students and the viewers have been asking me that we have been watching your videos and they seem to be quite interesting, but we would like to know about the herbs in terms of how those herbs actually heal or help in curing certain disorders. So this is the first video in this series, but it's certainly not the last, and I will be updating and adding different videos for different disease and disorders. Now, in this particular series, my effort is not actually to educate you or give you information, detailed information about healing those diseases, because it would be out of the scope and video would be too long. But here my effort is actually to educate you about certain herbs in Ayurveda which are quite handy, quite beneficial in treating certain disorders, which are quite common in today's life. You can also call as a chronic and the lifestyle disorders which most of the people are suffering nowadays. So today we are going to talk about a very well-known and widely prevalent disorder, which I would also call a lifestyle disorder, is diabetes. So we are going to talk about diabetes today. I'm not going to explain you a lot about diabetes, but going to give you a brief introduction, and then I will come on the herbs which would help in curing diabetes or managing diabetes to a larger extent. Here we won't be discussing about the food and the diet part, nutrition part of Ayurveda, which can also help you to manage your diabetes, which is known as the Madhumeh in Ayurveda. Well, there are 20 different variations of diabetes, which is also known as a prameha, caused by 3 different dosha: Vata, Pitta and Kapha. So the most prominent dosha which is involved in the creation of or the causing diabetes is Kapha. And we have 10 different prameha or the variations or conditions which could lead to diabetes due to Kapha or aggravation or vitiation of the Kapha dosha. But it's not, as I already told a lot in my different courses and videos, that it is never a single dosha which results in a manifestation of any disease or disorder. It's always a combination. So it's not just Kapha, but Kapha is prominently involved here. Now the second is a Pitta prameha, and there are 6 different variations and combinations of Pitta prameha which can cause Madhumeha, which is diabetes. And how many are left? 10 plus 6 is 16, and then there is 4. So 4 prameha, the Vata generated prameha, which are caused prominently by the vitiation or the aggravation of the Vata dosha. Now out of these 3, the first 10 which are caused by the Kapha are definitely treatable and curable. I mean, everything is curable, but they are quite manageable and curable with the help of all the Ayurvedic herbs and the food, diet and nutrition. And the second category, which is of the Pitta prameha, in which we have 6 different variations, are also treatable, but it is little bit difficult. I mean, you have to work harder, you have to go for stronger regimens and lifestyle restrictions, and of course the nutrition and diet and nutrition part and herbs as well. Whereas the last 4, which are Vayu generated prameha, are difficult to treat, and it takes a lot of time and effort to heal that. Well, Ayurveda mentions there are certain preliminary symptoms of diabetic condition, like accumulation of tartar on the teeth and burning sensation on the palms and the soles, and also the stickiness or the certain skin infections and eruptions all over the body, and there is a persistent sweet taste in the mouth. and also abnormalities of the urinary system, because diabetes is basically connected to the urinary system and connected to your pancreas and kidneys, and those are the main organs which are involved here. Well, non-insulin dependent diabetes mellitus, which is also known as the NIDDM or the type 2, usually is because of the sedentary lifestyle and the wrong and the compulsive eating habits, and it is diagnosed mostly after 40 years of age, and 90% of diabetes in our culture are type 2, but they could be type 1 as well. NIDDM is a disease of loss of sensitivity to insulin, or we can also call as insulin sensitivity and resistance as well. And typically insulin levels in the blood are actually increased, but the tissues have lost their ability to respond to the hormone. So that is how it manifests in our body. And the typical NIDDM patient is a classic example of kapha generated prameha, which I talked about, and it is also the kapha derangement. Mostly the fat, the slow, the greasy, cold, even the urine is sweaty, and getting kapha under control makes this type of diabetes easily curable. So there are major complications which arise because of diabetes if we don't manage it. The most important complication would be the deposition of the cholesterol in your arteries, which is also known as the atherosclerosis, deposition of that fatty, substance in your arteries, which actually harden your arteries and increase your blood pressure. And when your blood pressure increases, it puts the strain on the different veins and the arteries and the blood vessels in your heart. So it can lead to the cardiovascular issues. It can cause the strokes. So it's very important to manage your diabetes to prevent the onset of these life-threatening disorders over the period of time. Then you could also have eye diseases, primarily because due to which there's a sluggish circulation of the blood in the blood vessels, and especially in the retina and your eye muscles, due to which it can actually impair your vision and also cause the eye vision damage, and in your eye you can become totally blind after a certain stage. So apart from that, it also causes the dental problems, because there is a lot of tooth decay and the bad breath and tooth infections, cavities can happen. Kidney failures and infections can happen. The most prominent complication would be the nervous disorders, and I would call it the diabetic neuropathy, where the different nerves and the blood vessels are damaged, and due to which you could have complication with the nervous system. And apart from that, it would also cause the sexual and the bladder urinary problems. Then other common disorders that it would cause are the skin conditions due to reduced circulations of the blood in the skin tissues and the blood vessels, and there are certain different kind of infections it could cause. So now let's talk about which are those prominent Ayurvedic herbs which helps to manage and cure diabetes. The first would be the green and the black tea. Yes, it is very common. We all love sipping teas with different infusions, but even if you don't put any infusions, you just put a green tea leaves and just infuse it or boil it for some time, maybe 5 or 10 minutes, and then you have it. Or you can also add ginger and different other herbs which would help in controlling your blood sugar. So actually green and black tea are powerful antioxidant plants containing catechin, apicatechin, and these are the compounds belonging to the flavanol category which have been shown to aid in diabetes. The bark of the asana, it is one more the herb in the Ayurveda, is one of the few remedies that is thought to have an effect on type 1 diabetes. Well, The clinical trials have suggested that asana is the only substance, the drug or otherwise, that is known to have this effect. Asana is another rich source of apicatechin, which helps in controlling the diabetes. Apart from that, another very useful herb in controlling diabetes is gurmar. And gurmar is truly a revolutionary herb, I would say. Its benefit extends to healing not only type 1 but also type 2 diabetes. It significantly improves cholesterol and the triglyceride levels as well. It certainly could be the backbone of a natural diabetes program, as per me. The next herb is fenugreek. We all know fenugreek. It is an effective blood sugar lowering herb. Since fenugreek actually tastes a little bit of bitter, a lot of people might not like fenugreek for the simple reason it tastes a little bit astringent and the bitter. But if you get used to the taste, then it has loads of benefit when it comes to controlling your diabetes. It may be more practical for people to use on a daily basis, I would say. Well, one study which was done actually claims that fenugreek seed is so effective in lowering your FBS, the fasting blood sugar. And also if you take fenugreek powder with turmeric powder, it really helps in managing your cough and the Vat induced pramehas or the diabetes. Now, well, it is not known whether the active principle in fenugreek lies in the high soluble fiber content, but that certainly works. And fenugreek is effective in both type of diabetes, is quite cheap, is well tolerated, and at 20% protein content, it's also a good food source for protein. The simple way to have fenugreek seeds is actually to soak in the water overnight, and in the morning you can just leave the seeds out, or you can also chew the seeds and drink the water. The other herb which is quite useful and prominent in curing and managing diabetes is Karela, which is known in Hindi. In India we call it Karela, but it is also known as the bitter gourd in English, and it is quite effective, being bitter in taste. I mean, it's quite bitter in taste. You have to add some tamarind or mango, dry mango powder when you make it as a vegetable with a lot of spices. But if you can, and if you can make yourself strong enough to actually take out the juice and take it raw, empty stomach in the morning or maybe in the afternoon, maintaining some gap between your meals, then Karela or the bitter gourd would really help in reducing your blood sugar and actually managing your cholesterol levels and the insulin levels. At the same time, Karela is bitter, but it is also astringent, and as we know in Ayurveda nutrition, that bitter taste help in managing the cough and reducing the cough aggravation, even the pitta aggravation. So in both cases, when the diabetes is pitta and the cough induced, which are normally 16 type of different conditions and variations, then it would be really helpful to use Karela. Well, next is the jambul fruit. Jambul fruit or seeds alone is used in Ayurvedic medicine as one of the most effective remedy for the herb for actually reducing blood sugar. It is a very powerful the hypoglycemic herb. Well, jambul is thought to be particularly synergistic with okra. Okra is another vegetable. If you take jambul fruit juice with the okra juice, that combination would also serve pretty well in managing your blood sugar. This is a neem. We all know about neem. Neem is a wonder Ayurvedic herb. It is used in so many conditions. I have recorded a separate video for the neem in my Ayurvedic herbalism course. If there isn't a video, then I would drop another video for neem. There are certain herbs it is not possible to talk about their benefits actually, because it's too broad. There are so many benefits. So I would put another video for the neem. But here, when I'm talking in the context of diabetes or the madhumeh, then neem is a powerful hypoglycemic herb in the sense that it stimulates insulin secretion in the pancreas, as well as possessing actions that support the immune system, which is often damaged as a complication of the most common herb that nobody takes into account and people normally ignore this herb, but it is excellent for digestion, because remember, these things happen from your digestion and the metabolism to start with, right? So ginger. So the herb I'm talking about is a common kitchen herb found normally in your kitchen is ginger. Ginger it's carminative, it's digestive stimulant, but it is also quite useful in reducing your blood sugar level. I would say that ginger acts in diabetes both by stimulating pancreatic cells and by lowering lipids, which is cholesterol, triglycerides in the blood. The next herb is tulsi, also known as the holy basil, and it increases the uptake of glucose in the peripheral tissues of the body, and therefore tulsi potentiates the action of all other diabetic medicines, including the insulin, bitter melon, and the neem leaf. So it acts as a catalyst basically. Google is a efficient herb because I feel that the 4 different conditions, there are 4 conditions or the pramehas which are induced by Vata. So in that case, we can use Google. Google is a classical Vata pacifying or the balancing herb, and it also reduces the cholesterol, balances the triglycerides in the blood. It balances the aggravated Vata. And Google also prevents abnormal blood clotting. So this combination of action is dynamic for reducing retinopathy, which is a classical side effect or the complication of diabetes. Neuropathy, which is the nerve degeneration, usually starting in the feet, and the gangrene as well, which is secondary to atherosclerosis and quite common that we may find a serious complication in diabetes. Well, the next herb is the kutki, and the kutki is basically bitter in taste. So it is quite helpful in reducing the pitta and the cough induced pramehas. And in general as well, kutki is an excellent herb for reducing the cough generated aggravated symptoms like cold, allergies. Diabetes is one among them. But it acts fantastically well in conditions of liver, kidney, so it acts on the urinary system as well. So kutki contains a wealth of medicines for diabetes. The main properties is about stimulating digestive secretions, which in turn stimulate the pancreatic insulin secretion. Kutki is also amazing herb for actually toning your immune function. Well, the kutki also assists in the liver in storing blood sugar in the form of glycogen, which is essential in diabetes management because liver stores a glycogen. So if something can control that, so it really helps in toning your liver and flushes out the toxins from the liver, that's how it proves to be very effective anti-diabetic drug, or the herb, I would say. Well, amla is also useful. Amla balances all the 3 doshas. So, and it also tones your digestive, then urinary system, reproductive system. So it increases your ojas. It reduces your Vata, Pitta and Kapha equally. So amla is one of the most wonderful, I would say, the herb in the Ayurveda, which has so many uses. It actually increases your immune system as well and lowers the blood sugar. Well, Shilajit is one more herb, which is not basically plant-based. You can call it as a mineral or the non-herbal mineral, which is basically found in Himalayas, in the mountains. And it is a general detoxifier and rejuvenative, and is particularly useful in diabetes. There are many of such herbs basically, and I have covered some of the most prominent herbs. There are also so many food, veggies and spices in combination of veggies which you can consume to manage your diabetes, but that would be the out of scope of this video because I'm essentially talking about herbs here. So I will record a separate video where I'll cover the food which helps in reducing your blood sugar. In the end, I would like to say that if you take these herbs, I'm not recommending you to take all the herbs in one go. That is a matter of consideration. Basically, experienced and knowledgeable Ayurvedic doctor or the therapist or the nutritionist can suggest you based on your conditions, the pathological analysis of your disease, what kind of diabetes it is, whether it is induced by the kapha, vata or pitta. Based on that, these herbs can be included in your treatment plan along with the suitable food items which you should be taking in your diet. So it has to be customized. So don't just start taking these herbs, but even if you start taking certain herbs like ginger or amla or probably holy basil, the gurmar, without any proper consultation, it would still help you. In fact, gurmar alone would reduce your triglycerides and the blood sugar level and the insulin functioning of the beta cells of the pancreas. It would surely improve just by taking the combination of these 3 or 4 herbs would really help you. And of course, in the end, I would like to say manage your stress, because stress is something that really suppresses your immune system, your digestion, your functioning of your pancreas, liver, and secretion of insulin. So stress is a silent or the hidden killer or the hidden factor behind most of the lifestyle and the chronic diseases. So make sure that you design your life accordingly, that you should be able to relax and live in peace, manage your relationships and your career and your work or the personal stress, emotions. Everything needs to be managed, which you can definitely do if you become aware of your lifestyle, your mind, how your mind is you're generating thoughts, what kind of thoughts they are. So if you manage to balance your emotions and mind, then that would really help to control and manage your stress levels, which would eventually help in managing your diabetes. And the physical workout or the exercise is equally important, but I won't recommend you to do a very intensive exercise. You can go for light, gentle, restorative yoga poses with the guidance of experienced yoga therapist who is specialized in yoga therapy. He or she would be able to design a sequence of asanas, pranayama, breathing techniques, and meditation, relaxation techniques, which would help to tone up those organs which are pancreas, liver, and digestion, and which would help you to strengthen and tone those organs and balance your insulin levels. Apart from that, the most important thing is to do the brisk walking. Walking is a very good exercise for diabetic patients. If they make a habit of walking like 20-30 minutes, like little faster, a brisk walk, that would really strengthen their cardiovascular system and their digestion, and basically the working out of the body, the circulation of the blood would improve. Nari Shodhan Pranayama and a lot of other yogic techniques would certainly help in managing your blood sugar level. So this was all about the diabetes management, and this is not a detailed video for curing or managing your diabetes, but essentially my focus was to give you some information about the herbs which would actually go to help in managing and curing the diabetes. But though you need a very detailed holistic health treatment plan under the supervision and the guidance of a very experienced, knowledgeable Ayurvedic doctor, therapist, or nutritionist who would actually customize a program for you. Thanks a lot. I'll see you in the next video. Till then, take a very good care of yourself. For more such informative videos on yoga and Ayurveda, subscribe to our YouTube channel and press the notification bell. Thank you.